The doctors' strike, which starts today and goes on for 2 days, is really shocking. There was an interview this morning with Nick Hulme, and Nick Hulme is the chief executive of the Ipswich and Colchester hospitals. I actually know him. I was at school with him. And he was asked whether or not there was support among the public for the doctors' strike, and he was quite evasive. He speaks very quickly. He said that public support is probably going to be there for them, but it cannot be certain because they earn more money than many people. However, they feel they've been left behind. Well, that's not quite the answer we were looking for. He says there's a growing sense of frustration where among the doctors and the nurses who do the work, or among the bureaucrats who are collecting the money. Nick, come on. There were clear questions, and you were ducking the answers. He pointed out that there's an enormous 750,000 number of patients whose care has been cancelled, and he thinks that this is going to get worse. Today, 750 outpatients have seen their care, their operations cancelled, 200 inpatients cancelled. This is sort of unacceptable. If you look at this from a different point of view, of course, we can look at it from the point of view of managing a strike. And I'm sure Nick is very good at that. But the greater concern is why are the bureaucrats running around the place collecting their pay when the people who are actually doing the work are forced to go on strike simply to meet their needs, simply to get better conditions. And part of the problem is the bureaucracy in NHS hospitals simply fails. The bureaucracy fails in terms of managing the staff who are there. The bureaucracy fails in managing the care of the patients who are being presented. I've said on many an occasion that the 2 times that I was in hospital, on both occasions, the bureaucracy failed, and I was put in danger, serious danger, by a failure of bureaucracy. In both cases, it was about one hospital talking to another. In the first case, it was about one hospital in the same hospital trust talking to another. And this failure of bureaucracy, that's the question that we should be asking. We should be asking Nick Hulme how he justifies his pay. That's the question. I don't understand why Radio 4 interviewers are being so mealy-mouthed when it comes to talking to senior bureaucrats. And I would love to hear Nick actually answer that question. How does he justify his pay when doctors and nurses, the people who are on the cutting edge of literally, of the hospital service, are struggling to meet their basic needs, when they can't park in the car park, when they have to park half an hour away and then walk to work, when you are so dependent on bringing staff in from other places. Why explain all this, and then explain how bureaucrats have such inflated pay. What do you do? Because you certainly don't answer questions when they're put to you by a newscaster or a radio anchor on Radio 4. You're very quick. You've got your prepared spiel, but it's not an answer to the questions you were being asked. Please, I look forward to hearing from you.